Hi, my name is Andrzej Jakubowiak. I'm at SOHO 2016 in Houston, Texas, where I presented opinion talk, Path to a Cure for Multiple Myeloma. As many of you know, and we write it in almost every introduction, myeloma is considered an incurable disease, but in recent years, we started believing that we do cure some patients, and it's a question, what is the proportion and how to prove it? Dr. Barlogi have shown in those consecutive studies dramatic improvements. Some of them have been eventually calculated to represent cure fraction of the patients treated with total therapy. But total therapy is not commonly used. In fact, is probably not used in many places anymore. And how about more current regimens such as RVD? These results from IFM study show very improving curves of progression-free survival of patients who achieved with RVD MRD-negative status by next gene sequencing while they were already in complete response. These results were in minority of the patients, and that potentially explains why overall survival curves are still not as good as we would like to see. So we thought that we can improve those results by applying similar strategy, but longer treatment with KRD regimen and using more effective proteasome inhibitor carfilzomib in this strategy, which is already published. And at this meeting, I presented updates from 2 consecutive studies with KRD with in yellow and without in blue transplant, showing a dramatic increase of stringent CR rates in consecutive time points and overall translating in improved in yellow again, progression-free and overall survival compared to blue from KRD study without transplant. And I would like to point out that those are in combination showing results which are even without transplant comparing favorably to any other treatment strategy in newly diagnosed myeloma. So is this the way to go forward, especially once we see MRD results in this study in pink in consecutive time points by 10 to the minus 6 sensitivity next gene sequencing methodology at 8 and 18 cycles, which translate in those looking flat for NGS patients, Kaplan-Meier curves for both KRD with and without transplant. So is this the way, especially with so many patients achieving complete response, as we now predicting by shape of this curve to go, to improve outcome and maybe cure some patients? I believe yes, and that's how I discuss, as long as we continue to collect more data, which will allow us to determine how many patients need transplant, how many maybe need alternative therapies like antibodies or other agents, and what are the time points in which we may potentially even stop the therapy. In all, those results are giving us guide to potentially using KRD as a backbone of strategies for not only improving outcome, but maybe potentially finding a cure for a good proportion of patients. But there's a lot of work ahead of us, especially that we know that even MRD positive patients sometimes remain for extended time in ongoing remission. That in total therapies, high-risk patients were not as improved as those with good risk disease, and that we still don't know at what point and based on what findings we should stop the treatment and what type of early findings can guide us to determine that we are in fact making progress without waiting 5 or 10 years until studies will mature. Thank you so much.